From your perspective, would you please provide a high-level overview of current federal level approaches to addressing Indigenous child welfare within Canada?
I guess, okay, from my perspective, I mean, we're in a totally different landscape right now with First Nation Child and Family Services across Canada, largely due to the new federal legislation, Bill C-92, also known as, now I should have had these papers in front of me, but an act respecting First Nations, Inuit, and Métis children, youth, and families. And so this act, this piece of federal legislation is certainly contributing to big change in Canada in regard to the jurisdiction, authority, and delivery of services to children and families who require supports. So their children, hopefully to prevent children from coming into care, and also to put more supports and to keep, or put, now it's legislative support and keeping families together, right? So we are experiencing, from an agency perspective, huge service delivery changes day to day. Basically, what I see with the new federal legislation, it's still government, it's still colonial legislation, right? That's what it is. And but it has the capability to remove the provincial involvement out of the equation. And whereas the First Nation within this federal legislation, I guess I'm not a politician or anything, but will exercise more like sovereignty approaches to responsibility and oversight for their citizens. And so we're seeing that. And that's a good thing. That's a good thing. Yeah, it's huge. And we have a community here in Manitoba that just passed its own child welfare law, and in conjunction with this piece of legislation, the law is posted on the Indigenous Services Canada's website, and there's a lot of changes right now with how this community will be delivering services, and there is an impact on the other agencies in Manitoba, because many cases are transferring right now from this First Nation community due to citizenship eligibility criteria that's entrenched in the law. And so there is a service delivery changes as a result of that.
And Trudy, is there not also something, I haven't had a chance to read your emails that you sent me previously about some new bill that the provincial government of Manitoba just put forward with regard to how to interact in these cases of First Nations children who are, or First Nations communities that are now creating their own laws, because that is going to change our relationship also with the provincial government. So it looks like they're trying to be proactive to some extent in terms of how to deal with these situations, because child welfare is still a constitutional responsibility of the provincial government. So I think they're trying to think ahead how to deal with this, but you know more about this than I do.
Yeah, it's fairly new. It's Bill 41. Let me just grab it because it just came out in reference to information sharing. So that information sharing in regard to obviously making sure safety for children, right? When we don't want to see kids fall through the cracks, it's important that our First Nation Indigenous governing bodies / service providers are able to access information to help us make informed decisions in order for children to remain safe, right? So things like the child abuse registry and other different types of personal information, that whole process right now is just rolling out how it's going to work, right? I don't even know if it's gone through, maybe it's gone through first reading, I'm not too sure. The Child and Family Services Amendment Act, and it's basically on information sharing and accessibility to this information. Because when we're making decision, children, like I say, if they've been in care or if they have to leave a placement and go to a new home, you want to make sure that the home they're going to is safe. In order to help make those decisions, you got to make sure that the caregivers are not on, child abuse registry, or if they do have a prior contact, that it's not something that's like high risk to kids. So we need to have this information to ensure child safety. So that was just recently introduced by the province of Manitoba, and it's just going through readings right now. How it's going to operationalize, I'm not too sure yet. We don't have those questions answered. Like, for example, so now, like, mandated workers, we have access to it's called CFIS, the Child and Family Services Information System, which is a provincial database that we can go in and check to see the child's background, their involvement with the system, all, case notes, child abuse registries, prior contact information, foster parents, all of that.
Although that system, CFIS, is not a perfect system, especially if you're in a remote community and you don't have very good access to internet services. So there are additional files held within the community that aren't always in the CFIS system.
That could very well be, yeah. And also there's been, over the many, many years, there's been other matters associated with CFIS from our concerns from our First Nations in regard to ownership of data, right? And sort of where the data is stored. It's a provincial database. That's what it is. It's a provincial database. It's owned by the province. That's also been a concern. I think it's really important as kids are moving within the system, and sovereignty, and it's about time, is being exercised in these areas. Thank God. We still don't want to see kids fall through the cracks, right? We have to make sure that the information is shared so good decisions are made, and we don't put kids in vulnerable scenarios or with dangerous caregivers, right? Because that's happened and the outcomes are not good.
That's so true. It has happened, right? And we know this. As a result of the federal level approaches, have there been any cultural, health, or socioeconomic challenges? It could be for parents, for children, for specific communities. These questions were written before this legislation, I think about a year and a bit ago. Yeah.
Okay. Well, I think as a result of the federal legislation, and then in conjunction to the over-presiding First Nation child welfare laws, that is the higher arching, I would think that, like, the cultural and the health and the socioeconomic is intended to improve because of First Nation child welfare laws. So I can say with, I can't say did the health improve or whatever for families, but I would say that the movement that has occurred within those communities that are exercising their authority to legislate and regulate and deliver, like, those types of services to children and families are done with the intent to improve socioeconomic and health and cultural strength of people. And I would think that has started to happen, particularly with this community in Manitoba that is moving forward in this on this path. because they've already, they've exercised and they've put it right in motion. Now the wheels are going, the laws have changed. Province has made regulation changes in the act, that this community is totally overseeing their citizenship off and on reserve. So I guess a sense of community, that's definitely fully entrenched, and service delivery is full force from the agency for those families and children.
Sounds like we're in this transition period, right? For the work that's being done.
Yeah. And you got to make sure you got good plans in place when taking that transition over. And it's done in a methodical, well-planned way. And I think we're going to most probably, as we move forward in the years to come with this federal legislation, I would say that we'll be able to embrace those teachable moments and good practices. I even identify some loopholes and some areas that need improvement, and eventually come up with a good like an ideal type of transfer process. But is that a one fit? Could it be a one fit all? I don't think so, because it's each community, right? See, that's the challenge, right? At the end of the day, when it boils down to the frontline work, when you're at ground zero with children and families, it's that transition. So I don't know yet what those specific outcomes are, because we're just finishing up a transfer process.
That's true, because I was just thinking northern Manitoba is going to be significantly different from southern Manitoba, just like how northern Ontario is completely different from middle Ontario and southern Ontario, right? All different, all with unique needs, and you're dealing with different nations. I know within Ontario itself, right, you have the Cree, OG Cree up in the north, and Métis, and then you have the Anishinaabe, and then as further south you come, you have Haudenosaunee and Mississauga territory. So the complexity of it all.
There's no rule book written on this. We're the rules, and we're learning. And as we go through this, like literally, yeah. My concern, as the executive director, my responsibility is for the safety and well-being of the children that fall under my agency. And so I got to make sure that we're in a position where we can safely undergo these transfers and transitions as best as we can, and that we have the resources to do so.
I think that you raise an important point there about your last point about having the resources to do so, because I don't think we have had the resources to do so. So maybe just Amy, to explain our connection between Trudy and I. Well, Trudy and I were part of we were engaged in the founding of this agency that Trudy is now the executive director of. So way back when, we were part of a working group in 2004, to create this organization, because it is unique, because we are servicing First Nations individuals that reside here in Manitoba, but have connections to First Nations in Ontario. So they have a very unique need, and there's a huge number of people from Ontario First Nations communities residing here in Manitoba. So anyway, when she talked about the socioeconomic, resources to help implement, the act, we don't have that, because we are constantly, and Trudy can attest to this, because I sit on the board of directors. Both Trudy and I used to be on the board of directors. Trudy was the past president and chair of our board, and then I stepped into that role. And so anyway, in terms of the resources to do this kind of work, we don't have that. Because, and Ontario, we're getting lots of calls from Ontario to let us know that we have some of their children in our care here in Manitoba. So we need resources to be able to respond to these requests that are coming from Ontario about their children that are here in our jurisdiction. So we don't have the people power to be able to do that on top of all the other work that we're required to do on a day-to-day basis. So it has impacted us in an economic way, because we know there's going to be more coming forward too.
That's the challenges we face as Indigenous community.
I just want to add to that. We don't have any monies that have been fronted to our agency to help with that transition period. So, we have to do it within our existing funding envelope.
Well, is that like an oversight from the federal government, just not taking to, or they're just like, whatever, figure it out?
We don't receive funding. Nimiiki does not receive federal funding. The funding we receive is provincial. Yeah, so we don't have any of that C92 funding. C92 funds are set really to under the federal law. Funds flow to the Indigenous governing bodies that have put forward intent to establish their own laws and set it up through coordination tables, the planning for that. So like we aren't, like the Nimiiki, we're not involved in that.
And if I could complicate things even more, we don't have a political base like of First Nations within Manitoba that will go to bat for our agency. We do have connections with the Ontario First Nations political organizations, but we don't have that local political representation here within Manitoba, which I think kind of complicates things even further, because we're trying to make inroads to develop those relationships. And, Trudy's done a really great job because she is from Ontario and has those connections. So I think that just sort of complicates things even further for our agency, because, we do fall under, the Southern Network of Care, which is politically has representation from all the Southern First Nations communities in Manitoba, except for our agency. We have no political representation, here in the province. So I think that also complicates everything, because we're in this really strange situation where we are expected to operate provincially, but we have inter-provincial relationships that we also have to maintain. And, that has to be ongoing, and we're still, trying to make those connections. Although I think we've done a really good job in doing that, but I think that there's something there that still needs to be explored in terms of how we can get that political representation for the Ontario First Nation citizens who reside here in Manitoba.
Like Marlyn said, we're very unique agency. We don't have that support like our sister Manitoba First Nation agencies do here within these provincial boundaries. But we have, there's good collaboration.
From your observations, have you noticed any differences on impacts on Indigenous parents and children during different points of the pandemic?
The pandemic has been extremely hard on our families and children in so many ways. Yeah, just the whole like isolation and lockdowns and all that, those kinds of attributes of the pandemic, school closures, daycare closures, all the extracurricular activities for external activities for kids, those closures. This has been really hard on our families, even more so on our families that the ones that are highly vulnerable and struggle, with poverty and that live within, difficult socioeconomic conditions, and to throw the pandemic outcomes on that, just like further escalates already an already trying situation. And so isolation's been hard on our families, and because of the lockdown. So we saw a eventually the outcomes happen. You know, if the police are involved, we saw an increase in domestic violence. I saw more after we're like the first little while when everyone's in lockdown, like we didn't see at that time an increase in crises, you know, that precipitated some kind of intervention that would happen. But eventually, as time moved on throughout the pandemic, I mean, I think the stress just gets too much on families, and then eventually we've seen in the last year, particularly a little jump in interventions and apprehension, and those were due to mainly substance abuse and family violence. So it's taken a toll, even more, the pandemic, on our families. It's been hard. And you know what's sad is that really I find that with this pandemic, our child welfare sector, the workers and the families and children that are involved with child and family services are sort of like we were forgotten. I never heard here in Manitoba, maybe in Ontario it's different, I don't know, but you would never hear public service announcements about, say, for example, our workers. We're essential service, right? We never shut down. I have not worked from home. I've been here since day one. Me and my senior management team, we've all been here, and we had to put staff in rotation eventually, so we mitigate the spread of any COVID in our workforce. So we'd have workers who could go out and provide the essential service of child protection work, right? But you never heard like the government, announce or provide any accolade to our frontline workers who are still fielding calls throughout pandemic. You know, pre-vaccination, particularly in the pre-vaccination phase, right? You know, so I mean, we're going in the homes with police officers and first responders and all that stuff, so we can exercise the provisions of the Child and Family Services Act. And that's 24/7. We're not a 24/7 designated intake. We have an office that does that here, like in Winnipeg. It's called Anchor, All Nations Coordination. But yeah, it's 24/7. And so, but I just felt bad for our workers. You never, the government leaders never mentioned those workers. You'd always hear accolades, and rightfully so, of course, to our healthcare workers and our first responders and personal care homes and our stores and all, every, but you never heard about our workforce. And you never really, the minister never talked about, our vulnerable Indigenous children and families that are already in such challenging, difficult situations, having to endure through this pandemic. And my hats are off to our families and children that did endure through this and maintained strength and stability throughout this time. Because it could have been a lot worse and it wasn't. So, all hands are on deck and we all work together. We were there for our families 24/7 for sure.
Those are all really important points that Trudy has pointed out. I'm actually involved in another research project, Amy, where I'm interviewing people who have been sexually exploited. So right now I'm interviewing adults with lived experience. So most of them are Indigenous women who, obviously with the pandemic, they'll moonlight and, on the side to try to make money. But I've met many women who have been in transition from a First Nation community, moved here to Winnipeg just prior to COVID. And then, of course, they're living in poverty. Their children are apprehended. And there have been situations where they don't get to see their children because in some cases, this is a vulnerable person. They've become homeless, right? We don't know if they have had their COVID shots, and that meant that then, that's kept them from seeing their children because they haven't been able to prove that they, have had their shots. And I mean, it's designed as a way to, keep both parties protected, but at the same time, it has, created this abyss between that parent and their child. And, with both parties, I think both children and parents not quite understanding. And on top of it, they're new to the city and they're living homeless now. And it almost seems like there is a level of services that has just sort of disappeared for, homeless parents. I don't think we know enough about their situation as well. I think we need to learn more about how that came to be and how, the way that it looks, given the pandemic and how it's impacted, them and their children.
From day one, I think we instituted our first pandemic policy on March 17th, 2020. I had to pull, since the pandemic, this is like putting all the hard copies in it. This is our pandemic thing, right? This is directive after directive and changes in health orders and all in changes to service provision and that. Family visits, particularly in some priority areas, were priority. The consideration was never if the parent didn't get vaccinated. The bond was that connection had to remain intact during this time, no matter what. And so those children would, we have the space here at the agency or home visit, depending, where the visit would take place with all the PPE is available, and that we ask the questions. If we have the visit here and the parent says, yes, I have COVID, well, I'm not going to let them in the building, right? We'd have to postpone the visit for, how many recommended days the science indicated at that time for the virus. But yeah, that was for us anyways, and that was entrenched in our policies, was those family visits. But they did diminish. This was very hard on children, but we were able to obviously provide virtual visits, and we provided the means so families could have those, like what we're doing right now on Zoom. Also, we never, because we're only provincially funded, the province of Manitoba did not and had never provided any exceptional circumstance funding for us to pay the extraordinary costs to manage an agency under a pandemic. Well, Marlyn, all the laptops, the machines, all that stuff, we absorbed that cost within our blocked funding to, we absorbed all the pandemic costs here at Nimikie.
Okay, but you also have applied to other organizations to help offset the costs that,
Yep.
associated with the pandemic. So
yeah,
Trudy has been very, she's looked for those resources to try to help hold us, the agency accountable in some ways to those children and families.
To get that little assistance. Yeah, no, but the province, our funder and our the minister who's responsible for children, we never received any additional funds from the province. So yeah, Marlyn's right. We were able to get a little grant here and there to help with the costs associated, for example, like with our youth and educational costs, right? Through the Children's Foundation of Canada, I believe. So that was able to help us. So yes, so the pandemic has been extremely hard on children, Indigenous children and families involved in child and family services. And things were shut, we had to, the programming though, we were able to continue virtually, but then, the mental health needs on our young people was so, I think eventually it just got to them, and it just was so long. And when you're already dealing with trauma, intergenerational trauma, this just it really compounded on an already fragile state, so to speak, right?
How have Indigenous communities addressed child welfare issues due to the COVID-19 pandemic?
So Nimiki's we're not the Indigenous community, but we work with, we have a very strong working relationship with our sister First Nation agencies here in Manitoba, who have offices on reserve. And then of course our partners in Ontario who deliver services on reserve. Our communities overall, that what I've seen, have developed and operated exceptional pandemic operation plans within their community, because I mean the fear is even, I mean the risk is even higher in our smaller community, because once that gets in there, it spreads like wildfire, right? You know, it had to be a lot more stringent and strict with the rules in the First Nation communities to protect the people, right? Yeah, I'm impressed from what I've seen. In regard to child and family services matters, Amy, I don't know. I would hope, and I think, I'm pretty sure that the children and families that were involved in the child welfare system that live on reserve were certainly well taken care of. I've not heard of anything tragic.
I'm just thinking, I was part of another child welfare agency and I sat on their board. But I know that in the early days of the pandemic, so I'm from Sandy Bay, so I sat on the board of directors for Sandy Bay Child and Family Services. And I know that they did a lot of work, like, working with families in terms of, getting food to them, getting the, masks to them, getting, making sure that they had visits and doing it in a virtual way if possible. But, so what's unique about also Manitoba is that our child welfare agencies are not restricted to services only within their community. So we are able to provide services to First Nations, families, concurrently, across the province. So, I just know in the early days that our agency was, very concerned about families, both for those children who are in care, as well as, for the parents, making sure that they were, maintaining that connection between the child and their family. So I think that they did everything possible to make sure that those connections were in place. But, in the midst of all of this, our agency, the whole structure was disbanded. I mean, this is another political conversation I won't get into. But I don't know if the reason the agency was disbanded because they were taking advantage of the pandemic, right? I think it's part of that. Because, a perfectly well-run structure was, there was a political decision to disband, that current existing, structure of that agency. It's still there, still operating, but I don't know. I think sometimes, the pandemic just resulted in some really bad decision-making as well, too, at the political levels. So, and I don't know how much those decisions have impacted the families of Sandy Bay. I think that there's been significant impacts. And I'll just leave it at that.
On the other side, like, I think also with child and family services delivery on reserve, we were able to maintain the safety standards, right, in delivery. For example, like, you have to, every agency, we have to have a face-to-face visit with a child in care every 30 days, right? Obviously, there were situations where we didn't go, like, to see them face-to-face, but we were able to do virtual, with the exception of some high-risk cases. We knew we had to prioritize, we had to go in there, and we had to set eyes on the child and the home and that. But there were cases where we were able to prioritize, where we didn't like have to go physically there. You know, non-high risk kids that have been in care for many years, very stable, and particularly the medical, the complex medical care need children that were, you needed to sort of prohibit as much face-to-face during that time for these kids because of their medical condition, their health status, very vulnerable. And so try to, you know, minimize that physical face-to-face as much as possible when necessary. So from a child welfare, yes. And I know that my sister agencies, because we would have like monthly agency relations, but it would be virtual. And so we'd report on this kind of stuff. So this is what I heard from them as well, you know, virtual, face-to-face, that type of thing. So these are the measures we took.
And also too, when I think about Sandy Bay, from where I'm from, I mean, basically they shut down all access into the community, you know, when pandemic happened, and it hit our community really hard. There are a lot of people that got sick. It was difficult on the community. So it was closed for a long time, but we have lots of kids who are residing in foster homes, group homes, you know, off reserve. So yeah, so there is that difficulty because people couldn't actually leave the community. And
that's right.
The community. So
couldn't go in. No.
So that I think is difficult for some of the families because you can't just, you know, so I mean, that's why, like Trudy was saying, we try to maintain that. But fortunately, you know, we do have an operational cell tower there, you know, to make, not cell tower, but also internet, right? So to make those virtual visits possible. But the other thing is not every family member has a computer, but everybody has, I think for the most part, a cell phone or something. So, you know, just trying to make sure that, you know, those connections happened in that way, despite the fact that our community was shut down where people couldn't leave or couldn't come into the community.
And that's right. Because I remember at that time, right at the beginning in 2020, when all, you know, everything started shutting down, I guess, after March 17th, actually. I'm going to just talk on one example. So it was after the first lockdown. It was moving towards when things started getting lifted after the first lockdown here in Manitoba. And we have a young man, I think he's an AYA, which is a youth aging out of care. So I think he's 17 or something like that. He's in our care, but his parent actually lived in Sandy Bay. And so at that time he was locked down, man, for months, and he was getting lonely, and our workers were meeting with him and getting him, you know, we were making sure we could get him stuffed so he could preoccupy his time, you know, and he said, I really want to go see my mom or my dad, you know, because he would have visits with his parent in Sandy Bay, or they come and like, this is how we all collaborate, right? So at that time, of course, the community was in lockdown, not bringing in anybody from the outside unless there's an emergency, right? Ambulance drivers, what have you. And so I had reached out to the Sandy Bay officials at that time, let them know some of the mental health struggles this young boy was going through. And they had set up, the community had set up a very good system. The approval didn't even come from the chief. It came from a community committee of different officials that would review everything. And at that time, when I put in the request to my colleague, who was the ED at that time, he had put in my request to that committee, and good for the community because the risks were so high. They said, listen, give us a week. Things are starting to lift. We'll get this young boy here soon, but not today. There's just because remember, we're in the unknown, right? We're dealing with that, you know, like COVID numbers, and it was too risky, but eventually we were able to, it went through the committee approved it. We got our young Billy out there to hang out with mom or dad for like a week. collaboration was really important particularly amongst our First Nation child welfare sector. We're a very close-knit bunch, and thank God for that. So we help each other because we can't rely on the province. We have to rely on each other. No. We rely on each other.
How has Canada consulted, if they consulted, the international declarations such as the United Nations Declaration on the Rights of Indigenous People, UNDRIP, and the Convention on the Rights of the Child, CRC? Has Canada consulted it during these times?
In regard to the pandemic?
Yeah.
I don't recall having any conversations from any political representative on either UNDRIP or this the Convention on Rights of the Child.
They haven't talked to us in regard to the to our children. 82, I would say most probably with the Nimikie, 82% of our children are associated with Ontario First Nations, so they're obviously Indigenous children, and they've never reached out to us in that regard for pandemic. But maybe other agencies they have, but not in Nimikie.
When I was with Sandy Bay Child and Family Services, I don't recall us having any conversations. And Sandy Bay does get federal and provincial funding, so we would have interacted with both levels of government. And I don't recall either one of them, having those discussions with our agency. But again, I was a board member. I might not have had those kinds of conversations. That might have been more at the executive director level. But usually he would have reported, on such conversations in, our board meetings. But I don't recall us really addressing either one of those particular pieces of legislation. Yeah. We know they're there. We're aware of them, right? We are aware of them, but we just haven't had those kinds of conversations around, or because it always seems like it's up to the agency to show how they're utilizing those particular, the UNDRIP and the CRC. But I don't think anyone's ever asked us how we're actually implementing them. I would imagine it would require a conversation. I mean, it would require a conversation with the agency, but I don't recall those conversations happening.
So how do you see UNDRIP and the CRC best reflected in Indigenous child welfare policies during the pandemic?
I just want to say this. I think when you, as for me being a board member, for me, you kind of take the responsibility for all those children that come into your care, right? And we're Indigenous people. So you want to make sure that, the work that your agency is doing, within the community, whether it's on reserve or off reserve, that you are implementing those principles that are set out in both the UNDRIP and the CRC. And I think our agencies, we do that. We go above and beyond. And I think that everything that we do really reflects those principles in the work that we've done in our communities. Because really we're responsible for those kids, and we have to be very diligent in making sure that we continue to protect them when they come into care, or even just engaging with our agencies, they don't have to come into care, right? And in many communities, maybe not in Nimikie per se, but in Sandy Bay, our agencies do everything. They're like the one-stop shop, right? You need something, you go to CFS, right? Because that's where most of the funding comes to, right? For most communities. So, and it's a social service kind of, service in the community. So they're often seen as, the place that you need to go to if, you need something.
Well, like Marlyn said, for Nimikie, I'm quite proud of our policies that we developed. And I believe that the direction that's provided in our policies respond to like the UNDRIP and the CRC. Yeah, like the recommendations and principles of that as best as we can, and to the highest caliber in the middle of a pandemic. I mean, we have no control over, like schools lockdown and all that kind of stuff, like, and what have you. But we do have control over the supports we provide to our children and families, taking into account all the different measures that we had to, so that we could prevent them from getting the virus and getting sick, right? We didn't get government support to do it. And I mean funding support, but we did it.
In your opinion, how can the Covenant of the Rights of the Child and the UNDRIP be best utilized within your country's federal child welfare policies and protocols?
Oh, that's a tough question. Give us a year after things start rolling out here, and I'm sure I'll have a different answer for that.
Especially with this new, what is it? Protocol? No, sorry, laws that are rolling out.
Oh, that's a C-92, the new federal legislation. Yeah.
And if you don't know the answer right now, we don't have to.
Yeah, I don't know the answer yet. I think they could have been most probably stronger in the legislation, with a more stronger emphasis on the rights of Indigenous children. I believe there could have been more wording enshrined in this legislation that the rights of the child, according to that declaration, preside over anything else. I think the rights that but the charter does, right? In this federal legislation, the Canadian charter still presides over, human rights, obviously. So that's identified in this federal legislation, because I'm sure down the road, let's not kid ourselves, there's going to most probably be someone may go to court on some stuff, right? Depending how things roll out. And they do talk about the charter. I think there could have been a bit more emphasis on the rights of the child under those declarations. It's so new yet. We haven't seen it. We haven't had an ample time to do any review or evaluation on the rollout of the legislation when it's actually being operationalized in a new law yet.
Yeah, and I would like to say that UNDRIP and the CRC have to be cognitive of the different perspectives on, what are the rights of children, right? Because there are cultural perspectives on childhood as well. And I think that, with the changes, with Bill C-92, right, the act respecting First Nations, Métis, or Inuit Métis children and families, there are those cultural perspectives of, about what is in the best interest of children. I mean, I think the act does, speak to that, but I think people need to, there's going to be local differences in terms of those understandings, but I think they need to be aware that there'll be different perspectives coming forward, and that they're all equally right, in their own way, right? Because you have to recognize that, there's diversity in our communities, and there's diversity in First Nations right across, the country. There is constitutional challenge to Bill C-92 right now coming out of Quebec. There's certain provisions within the legislation of Bill C-92, an act respecting First Nations. I think Quebec is challenging, the Constitution. I forget which provision. I don't know if Trudy, which provision of, the act that Quebec is challenging.
I'd have to find the article, Marlyn. I'm not fully versed in it. I would say that, there's huge components of that federal legislation, Amy, that talks about it specifies and defines the best interests of the child, and it definitely prioritizes with their community, with the family, the cultural ties, the languages. So that is in line with the rights of Indigenous children. I mean, there's components with that for sure. Absolutely. So it's good to see that.
Do you have anything else or a bit to add?
Well, I guess as it pertains to the pandemic, I think the government could have done a better job in supporting the operations of a First Nation Child and Family Services Agency. As it pertains to the Manitoba provincial government, yeah, there were no additional resources, financial resources anyhow, to deal with the day-to-day stuff. There was a time when they gave us little paper bags with a rubber gloves and a mask. And what else was in that paper bag, Marlyn? A gown and goggles. We had those issued to us. You know, we had hand sanitizer, supplies of that we would go pick up, that we were able to provide, that we had to use, obviously. And then after the vaccinations were out, we were able to get some self-tests that we could utilize within the agency for our own operations and for our own workforce issues. They had, the province had regularly issued out directives within the sector, but most of their directives were concentrated on the group home sector within child and family services. Like the workers that work in group homes and other residential situations that are living in homes around the clock with children in care.
And I just would add that I don't think Indigenous people have received the support that they needed during COVID. Like I said, with regard to another research project I'm involved in, I have spoken to numerous individuals who have been engaged in the sex trade over the COVID, and a lot of them, they became homeless in the process, right? They've had children, their children were apprehended. I don't know which agency, because that wasn't the purpose of my research, but I do know from my conversations that there are many people who became homeless during COVID, and as a result of their homelessness lost, custody of their children. So they are engaged with the child welfare system, but also knowing that there are some relationships that have been severed because of COVID. And I don't think we know enough about, those experiences to understand, how that came about and why, beyond the fact, that there was a pandemic, but, how were those cases handled?
If they were handled at all.
Yeah.
I say that like in the appropriate manner.
In our agency, that we've been able to account for 52 children/youth that got COVID up until now. And then out of that 52, four of those children/youth got it twice.
And also, Trudy, that reminds me, there were a couple of parents too that also died from COVID as well.
Definitely one parent who died, and her her teenage daughter came into care. We were providing home supports, like family supports, and then the mother passed. She got COVID and got sick. We just had a grandmother this morning yesterday, day before, I think, who we just did a reunification. The kids were living with grandma. She had been suffering. I just found this out. She had been suffering with diabetes related illness. And I think she had a part of her foot amputated, and she just got COVID and she died. She got really sick. So grandma's gone. And so we were just helping with the funerals, like the family supports for this. I don't know if she died of COVID, but COVID certainly didn't help her already health status.